Good morning. My name is Dr. Jonathan Fialco. I'm the Chief Population Health Officer at Baptist Health South Florida, and I have the honor and pleasure of introducing a panel of experts and moderating this informational session. Joining us today are Nancy Batista-Rodriguez, the CEO of Baptist Health Outpatient Services, which includes urgent care centers, ambulatory surgical centers, diagnostic centers, and freestanding emergency rooms. Dr. Michael Zinner, who's the CEO and Executive Medical Director of the Miami Cancer Institute. Dr. Javier Perez-Fernandez, who's a pulmonologist and the Chief of Critical Care at Baptist Hospital, and Dr. Samer Fahmy, Chief Medical Officer at Boca Raton Regional Hospital. Baptist Health has been at the forefront of responding to the COVID-19 pandemic through the initial phases and quick assessments and actions that have ensured the safety of our patients and staff and community. We're now ready to move beyond that with enhanced safety measures and new processes designed with your health in mind. We're confident that we are ready and able to take care of all of our patients again, including those seeking elective care and those who have delayed care for the last couple of months. That particularly concerns me as a preventive cardiologist. We're already seeing an increased number of heart attacks and strokes and even deaths from patients who have not sought appropriate timely care due to their fear of COVID-19 infection. We're currently performing diagnostic tests for patients, elective surgeries for same-day discharges, and even patients who require an overnight stay. Soon, we expect to move to more complex surgeries and procedures. The enhanced safety measures put in place to prevent exposure and spread of infection for our employees and patients are very transparent. And we're going to start our conversation with Nancy Batista-Rodriguez. Nancy, you've led a team of accomplished individuals to develop and incorporate new safety measures that are now in place across all the Baptist Health South Florida facilities. What would someone expect to see when visiting, say, an urgent care center or a Baptist physician office due to the prevention of the COVID-19 infection risk?
So throughout all of our facilities, the processes are pretty standard. And again, we wanted to make sure whether you were walking into a hospital, an urgent care center, a physician practice, that you would see and experience the same thing. And what would that look like? From the screening process at the front door, we ensure that every patient that walks through our facility, as well as staff and physicians, are wearing a mask. Our registration processes have been enhanced to ensure they're contactless as much as possible. You look at our waiting rooms, and they do look very different than what they did in the past. We've ensured social distancing with the separation of chairs within our waiting rooms. We have markings on the floor that show where people need to stand. Within our front desk, we've also installed in many of the areas plexiglass for the protection of patients and staff. We've even looked at our snack stations and coffee stations and just temporarily suspended those, again, for the protection of our patients. And when you look, again, just across our organizations and our facilities from an infection control perspective, we want to ensure that hand hygiene is practiced across in a very robust fashion. And we have processes to ensure that all surfaces are cleaned very regularly. So again, the most important thing for us is the protection of our staff and our patients. And we really want to make sure that everyone who visits our facility feels very comfortable. And as you mentioned, we don't want our patients to delay care because, again, you're going to hear that from our physician experts, the negative consequences of doing that.
Nancy, if you could just add, and I'm going to ask all the guests this is an ongoing process. It's not as if this was just done and now we're good to go. Can you talk a little bit about the resources that are in place to monitor and make sure this is continually being done and appropriate for the status of our community?
Yes, so closely we monitor, many different metrics to ensure that as a community, the cases of COVID are decreasing. And from a leadership perspective, the expectations of what we want to see in our facilities, rounding of our patients and of our facilities, ensuring that all of the measures have been put in place and that all of those practices are happening in a very consistent fashion. But we are in constant surveillance mode, if you will, ensuring that we are progressing from phase to phase as we've planned to.
So Nancy, I had mentioned in our introduction, it's a great transition to a question for Dr. Fahmy. Sam, you, I, others, we've discussed at length the need to communicate with our patients that they should not delay care. What can one expect, for example, in the emergency department at Baptist Health South Florida to provide the confidence that this is a safe environment where they can seek help, they can seek care? And can you also, add a few comments on specifically the importance of seeking medical care wherever it may be needed should you have an issue?
Yes, of course. So, throughout the pandemic, since it began, people have been weighing the risks and the benefits of presenting for medical care. So whether to seek out medical care in an emergency department and potentially contract the virus versus stay at home. And people are afraid. People were afraid to come in and get seen. But you could be yourself at risk of serious complications or even death if it's a serious condition such as a heart attack or stroke or other serious illnesses. So if you go to the emergency department, it does not mean you will automatically be exposed to COVID-19. Several safety measures have been put into place in our emergency department, separation of patients that have respiratory symptoms into separate areas so that we don't have mixing of patients that may have potential for COVID-19 with others. Symptoms of a heart attack or stroke are especially important reasons to seek out emergency care. If you're experiencing chest pain that is particularly new chest pain, or chest pain that's different than what you experienced before, one that's accompanied by shortness of breath or pain in the left arm or jaw, or generally feeling unwell, definitely present to the emergency room. You need additional care. If you have symptoms of a stroke with weakness or numbness in your arm, leg, or face that is new, and it's definitely important to present early. That could mean the difference between full recovery and living with a lifelong disability of sorts. So critically important to present, and we have put in many safety measures in the ER to make sure that patients are protected.
So someone coming to the emergency room should feel confident that they will be screened and they will not necessarily be exposed to someone who might be there with a COVID-19 related problem. And Sam, also, if you could just elaborate, even in the medical practices, similarly, not everything's an emergency. So people, we don't want them to run out of medications. If they have other symptoms that are of concern, you speak to the need to continue to follow up with the medical providers?
Absolutely. And most medical providers within our system are now providing both face-to-face care and telemedicine care. So the care that you've been getting as an outpatient should continue. And if there are new problems, definitely contact your doctor, set an appointment. If it's something that requires a face-to-face visit that is scheduled, we have proper safety protocols in our outpatient areas, in the office waiting rooms, like Nancy mentioned, and even in the exam rooms to ensure that patients are safe and our providers are safe. But the telemedicine visits have truly helped. If, for people running out of prescriptions or continuing ongoing care of chronic conditions, telemedicine has been a great help, and most of our providers are able to give that type of visit to a patient. So absolutely seek out the care that you need. Don't ignore your symptoms. If they seem serious, present to the emergency room. And always, if you have questions, contact your doctor and they'll direct you on where to go.
Yeah, wonderful. Great advice. At this point in the panel discussion, I'd like to take a moment to play a short video that shows some of these new safety measures in hopes of decreasing the uncertainty that can lead to anxiety that one may have when they're seeking medical care.
At Baptist Health, the safety of our patients, caregivers, families, and visitors is our top priority. We are here to continue serving you during these unprecedented times. Because we care, we are rolling out precautionary measures to keep you protected. Patients will be screened for COVID-19 through a touch-free temperature scan, as well as symptom checks related to potential exposure to the novel coronavirus. Our lobbies and common areas have been modified and appropriately marked to identify areas where it is safe to sit and stand. In some cases, if you prefer to wait in your car, please feel free to do so, and we will contact you when it's your turn. We are asking that only the patient come inside the facility, with the exception of a parent that is accompanying their minor child, or other limited special circumstances. Everyone who enters our facilities will be required to wear a mask, which we will provide to all employees, medical staff, patients, visitors, and vendors. We will ask you to remove personal face coverings while inside our facilities. Hand sanitizer and disinfecting wipe stations are available throughout our facilities. We encourage you and our caregivers to wash hands liberally. High-touch surfaces like light switches, door handles, and bathroom faucets will undergo frequent cleaning. We have an adequate supply of protective equipment for all of our team members and medical staff, including masks, gloves, gowns, and face shields. This helps protect you and our team from COVID-19 transmission. A patient who is suspected or confirmed of being COVID positive will be isolated in a dedicated area to avoid cross-contamination with other patients. We are following Centers for Disease Control and Prevention and appropriate state guidelines to keep you and our team safe. When you need us, we are ready to continue caring for you. We are Baptist Health. Keep caring. Live healthy. Stay strong.
We hope that video helps visualize what a patient experience would look like in these new times. At this point, I'd like to bring in Dr. Perez Fernandez into the conversation for his insight. Javier, you've been heavily involved in the patient care at Baptist Health since the start of the pandemic. Take us back a bit and explain what you've seen evolve at Baptist, and specifically how we prepared for the ICU capacity.
Thanks, Jonathan. I think it's very important to mention and echo some of the words that we already heard during this presentation. We are a large system, and obviously we cover over 4 counties. So there were times that we had a significant number of patients admitted to both the floors and also the intensive care units, and we were able to manage them. But right now we have a significantly less number, so our proportion of patients admitted is significantly less. We even have days that we don't have any patients admitted with COVID-19. All the time we had a separation for those patients, as is mentioned during the video, and they've been isolated in specific areas. And again, the idea was to protect not only themselves, but also to protect all the possible patients and healthcare providers to designate the areas. That has been a very important process. As far as the preparation, I believe that we were doing significant actions for preparation for years. Baptist Health South Florida has been one of the most important centers in bringing every year a drill to prepare the personnel and the leadership for different epidemics and different pandemics. Obviously, pandemics were not really the ones that we were looking at. We were preparing for other disasters, such as hurricanes, but also part of the preparation was about pandemics. So we were actually prepared. We had the system already designated for leadership, for communications, for how to implement different measures. And another important factor is that we took very early action on everything that we did in the hospital system. We were prepared. We also saw what other people were doing as far as preparation and what we're suffering in their different centers, and we were able to prepare for that. And I think, again, there's been exemplary developmental leadership as well as organization within the entire system.
I think the collaboration worldwide is something that was quite remarkable. I know even very early on you were speaking to doctors in New York City, which was hard hit, or even Italy. So again, I think that collaborative effort really made a big difference in allowing us to adjust and prepare. And as you say, we do have capacity. What's the likelihood of needing it? I know that's a loaded question, but do you feel that the worst is behind us, or perhaps more importantly, what could affect us negatively to put more stress on our system?
Well, I think it's important as we open the doors and we start seeing cases coming to us, which is what we see and we want to, because obviously you mentioned how important it is to be treated for your conditions. And we want to, number one, transmit a message of reality. The reality, I believe, and again, we had a small number of cases right now. We have a complete an implementation of different measures to protect everybody that comes to us. And I think it's very important. But as important as it is, it's also tremendously essential not to lose our guard about the possibility of a rebooting or having new infection. Again, not to relax our measures, to continue with the hygienic preparations, continue with the social distancing, continue kind of essentially seeing and following every one of the particular policies that we are implemented. And I think they're super important to maintain on that. But again, a big message of I will say, big message of confidence in our patients that they can come to our centers and there is absolutely no risk for them to be infected in here. So, and I think it's very important that they understand that.
The slogan I use and all the leaders on this call is certainly a part of this is we can be optimistic, but we will not be complacent. We will continue to stay on guard. We will continue to monitor and make sure that we provide a safe environment for patients with COVID-19 and those without. Dr. Zinner. Dr. Zinner is the lead of the Miami Cancer Institute, as well as instrumental on the various surgical committees which are involved in safety and performance in order for our abilities to resume surgical procedures. Two questions. The first is the MCI, the Cancer Institute population, are particularly vulnerable. Many people may not realize the Cancer Institute has remained open through this whole pandemic. Mike, what were the specific challenges and how were those challenges handled for the patients who are receiving and seeking care at the Miami Cancer Institute?
Thank you, Jonathan. As you mentioned, the cancer patients we're caring for are probably the highest vulnerable patient population that we have in the system. Many of these patients are immunocompromised. Many of them are under active treatment. Many of them are seeking either radiation therapy or chemotherapy, and puts them at higher risk. So what we've done is rearrange how we're taking patients in. We were seeing up to 1,200 patients a day walk through the door. We then went to a lot of virtual follow-ups with telemedicine. And fortunately, we had a great telemedicine platform that Nancy had previously set in place. We also were intent in making screening as patients come in the door very important. So we used to have 10 different entrances to MCI. We limited that down to one entrance for patients and one entrance for employees, all employees. And so everyone that walks through the door first gets a hand sanitizer, then gets their temperature taken, then gets asked a series of questions about symptoms related to COVID. And if any of those answers are positive, they immediately get tested for COVID in the facility. And that's true for our employees too. So all of our employees now walk through a single entrance, hand sanitized, temperatures taken, asked a series of questions, get a new mask. Everyone gets a mask as they walk through. So all of those were to limit the potential exposure of either our patients or our staff to what could be COVID. In addition to that, we've done much as what was described earlier. We've rearranged all of our waiting rooms so that they're distant and appropriate for socially distancing. We've decreased the number of visitors. In fact, we've eliminated the visitors. We're trying to decrease the contacts of anyone that could potentially have the illness. And I can say, knock on wood, I don't think we've had a single internal transmission since we opened. There have been some patients, or rather some staff, that have received or have gotten the virus, but almost all of them, to the best of our knowledge, have been community contacts, and then we quarantine them until they're COVID negative. So we've been very, very rigorous about bringing patients in and making sure they're safe. And so fortunately, for chemotherapy and for radiation therapy, we're at about 80% of where we were pre-COVID. So we've been very fortunate so far, and we're going to be as vigilant as we can going forward.
And what you just articulated was a complex, complicated meetings, decisions, implementations by a multitude of people with, as you said, great success, as evidenced by the continued work and the safety of the people that have come through. Mike also can now comment a little bit, another lead role for you, which is also very relevant and somewhat related, has to do with the surgeries, elective surgeries. Can you speak a little bit about both the collaborative effort that went in place with the committees, as well as what has been done to provide the safety for elective surgeries that may even require an overnight stay in the Baptist facilities?
You know, in early March, we realized how significant this epidemic could be. And so we shut down elective surgery and postponed those cases that could be postponed until we thought we were in a safe environment. Now, that's not true for some cancer cases. So cancer cases cannot always be postponed, and we were able to continue those. But for the truly elective cases, what we did was stop them, and then we met weekly until we came up with a format of what would it look like to safely open our environment. And we met system-wide, and we met with everyone involved, from pre-op anesthesia all the way through recovery room, inpatient services, respiratory therapy, et cetera, and decided we'd do it in stages. And the first step would be to do things that were elective, that can be done where patients go in and out and be very safe. And then the second step, once we knew that that was able to be done safely, to do patients that could stay overnight, but not require ICUs or potentially long hospital stays. And then once we felt comfortable with that, then we would open it up to be as close to normal as we could. But every single patient that comes in pre-procedure will be tested for COVID to make sure that they are not COVID positive, because that has implications not only for the staff, but for the patient. If they were COVID positive, they are at higher risk to develop complications. So we've been very, very rigorous about that testing and about how we're doing it both internally and through our external labs in our outpatient services.
Thank you. Thank you for that insight, Dr. Zinner. Dr. Perez-Fernandez, hopefully you've been taking notes, although I know you know all this information. For those watching who would like some information in Spanish, could you summarize some of the things that Baptist Health South Florida is doing in terms of some of these new safety measures?
Of course, Jonathan. En un gran esfuerzo que ha hecho la organización del Baptist Health del sur de la Florida, se han implementado una serie de cambios que van a ser realmente promovidos para la seguridad de los empleados, pero sobre todo del público que va a venir y los pacientes que van a venir a ser atendidos. Han hecho una serie de medidas que son muy importantes y que están siempre de acuerdo a las recomendaciones del CDC y de las organizaciones internacionales obviamente más respetadas. Por un lado, se van a reforzar la limpieza de las áreas de contacto frecuente. Va a haber un uso obligatorio de las mascarillas para todas las personas que entren al hospital o a los centros del Baptist. Proceso de inscripción que va a tener sin contacto con nadie, es decir, que va a ser totalmente lo que llamamos el contactless. Un examen de detección en los puntos de acceso. Y hoy en día tenemos examen de detección que nos permite una detección rápida y es muy importante porque vamos a tener los resultados inmediatamente. Una opción para esperar en las salas de espera y también que van a mantener, por supuesto, el distanciamiento social. Inclusive usted va a poder esperar en su automóvil de tal manera que no tenga que estar en la sala de espera y se le va a avisar para entrar a los centros. Estaciones para desinfectarse las manos que van a ser presentes casi por todos los lugares. Las puertas corredizas van a ser automáticas de tal manera que usted no va a tener que contactar en ningún lugar. Va a haber una zona muy específica para pacientes que tengan COVID-19 y que no van a necesitar estar junto con los demás y que va a poder presentar, por supuesto, una mayor seguridad. Cuando usted se encuentre al entrar en un counter, usted va a entrar una división en plexiglass, va a poder ver a la persona, pero no va a estar en contacto directo. Va a haber una pequeña separación. También va a haber zonas demarcadas en el piso para señalar el distanciamiento social y recordárnoslos a todos. Las sillas en salas de espera van a estar separadas adecuadamente y se van a eliminar las revistas de las mesas, el café, los refrigerios que teníamos de otra manera. De nuevo, en un intento para mantener en todo momento la higiene. Es muy importante señalar que desde que se abrió el hospital y los sistemas hospitalarios no hemos tenido ninguna persona que haya visitado que se haya infectado. Y esto es muy importante. El doctor Sinner ha nombrado que ya el Cancer Center está ofreciendo servicios normales y así todos los hospitales también. Y yo creo que lo principal es que estamos salvaguardando su seguridad, que es lo más importante ante todo. No debemos bajar la guardia, que es lo que hemos señalado también. Esto no está necesariamente detrás de nosotros. El COVID-19 ha venido a quedarse con nosotros. Vamos a tener que aprender a convivir y vamos a tener que mantener este distanciamiento y esta protección que muy bien el Baptist del sur de la Florida ha sabido implementar en todos sus centros. Thank you, John.
Muchas gracias. At this time, I'd like to answer any questions that the community may have. Some came in through the Facebook comments. The first one I'll give to Dr. Fahmy. Are COVID-19 patients in a separate part of the hospital with separate staff?
Oh yes, and that's a great question. It was one of the very early measures that we took during this pandemic is to make sure that any patient that had a risk of transmitting the virus to another patient in the hospital was cohorted on a separate unit. And we do have every one of our Baptist Health South Florida hospitals has a separate COVID unit where we have specially trained staff with the proper personal protective equipment there to deal with these patients. And with much closer monitoring, typically closer nursing monitoring to make sure that the progression of disease is being monitored closely and that we respond to it quickly. And as a benefit of that, making sure that any patient with COVID is in one unit allows us a bit more peace of mind, knowing that anywhere else in the hospital is protected and should not have a higher risk of exposure throughout the rest of our hospitals of COVID-19. In many areas, we have special transporting procedures, special elevators used to transport COVID-positive patients, special imaging equipment that is reserved for COVID-positive patients. So we've tried to take every measure possible to ensure that these patients are isolated, protected for them, and the safety of all the other staff.
Thank you. Thank you. The next question I'm going to give to a couple of you. Are all aspects of the hospital up and running as usual with precautions? First, Dr. Fahmy, again, just to elaborate on the medical floors, then maybe Dr. Perez-Fernandez on the ICU, and again, Dr. Zinner on the surgical space. Are all aspects of the hospital up and running as usual, just with precautions?
So I'll comment on the medical floors. Absolutely, yes. We are up and running. We are, we are fully functional in terms of all the services that we can provide in a medical unit, including all our inpatient services for our hospitalized patients. We are able to provide those. Again, we have different safety protocols when it comes to a COVID patient versus a non-COVID patient, but all services are a go.
And Javier, regarding ICU, maybe ER?
Yeah, from the perspective of the intensive care units and other areas of critical care services, including the emergency department, there's been always a separation between, as Dr. Fahmy had mentioned, it's always a separation on the patient that is highly suspected and or COVID positive. In this case, our separation continues. We are full throttle and all the services provided in the hospital. Our ICUs have been always working in both scenarios, the non-COVID patients and the COVID patients again, and we are continuing in the same matter. Yes.
And Dr. Zinner, surgical services?
We're about midway through opening. We are opening slowly and carefully to make sure that we're able to care for the patients appropriately, and we keep one eye on where we are in terms of a potential second wave of patients being admitted, and we need to make sure that our hospitals have all the capabilities in the inpatient side to take care of both the COVID and the non-COVID patients. But I'd say we're about halfway through our opening and expect that to be soon.
So thank you for that answer, folks. And that's a great transition to our next question, which I'm going to give to Nancy Batista Rodriguez. What happens if we get hit with a second wave of COVID-19? So specifically, Nancy, what is in place for both monitoring and preparation should capacity become an issue again?
So great question. So as part of our recovery task force, which again, we've talked a lot about all of the measures that we're taking to prepare as a system, we do have very robust data that we look at on a daily basis. The number of cases that come into our hospitals, number of patients within our communities with flu-like symptoms. So again, we are in constant alert. So if that were to happen and we see those numbers spike, as Mike said, we may take a step back in the types of surgeries that we perform. Again, we would look at staffing, we would look at personal protective equipment, the availability of supplies. So we are on constant alert, looking at those numbers and that data, both on what that looks like within our facilities and within the communities and the counties in which we operate, so that we can, again, if appropriate and needed, we could take that step back.
So again, iterating patient and employee safety is paramount importance, and support of the community is the mission.
Absolutely.
Dr. Fahmy, how is Baptist Health taking care of children?
Generally speaking, a lot of our safety protocols that we put into place apply to children just as much as adults, whether it's screening at the front door of our EDs to ensure that you don't have respiratory symptoms. And if you do, making sure to take those precautions up front and to isolate people as soon as possible upon walking into our doors. That applies to kids as well as adults. In terms of other safety measures, where every staff member that you'll meet within our hospitals is wearing surgical masks, so that in case of somebody being an asymptomatic carrier, that reduces the risk of transmission drastically from anybody that's around the patients that are coming in, whether kids or adults, to the patient. So I think the services that we provide to kids are still available, and they're being seen in the ED and in outpatient services just as much as before. Just with added safety measures in place.
Thank you. Thank you. Should I make an appointment for my annual mammogram screening? We won't get into the medical indication. Nancy, is it safe to have a mammogram done?
Absolutely. So again, all of our diagnostic facilities have all of these safety measures in place for imaging. We have a triple check screening process where we talk to our patients at the point of scheduling and go through the screening questions. We also call them the day before to ensure that they're coming for their test and make sure that nothing has changed in their health status. And again, they are screened a third time when they come into our facility. So again, all of the very robust safety processes are in place before the patient gets to our facility, as well as once they arrive, to ensure that all is well with them.
And
Jonathan, if I could just follow on with that, it actually worries me that patients are not doing their routine screening for cancer, that they're not doing their appropriate colonoscopies, that they're worried about somebody getting infected, when in fact they may be at higher risk for not having the appropriate screening. So I would just re-emphasize what Nancy said. We're open, we're ready, we're prepared, we're taking every care we can to make sure no one gets the virus, but also gets appropriate cancer screening.
I thank you for that, Mike. And I'm going to add to that childhood vaccinations. Make sure everyone continues with the normal schedule of vaccinations for their children. Those remain significant risk if we avoid what has already been shown to be beneficial. So absolutely. How long does it take to get a COVID-19 test result? And where can people get tested? Broad question. I'm going to break it up a little bit. So first, Mike, maybe you could speak to the testing screening before procedures and what's been put in place and how that's being done.
So every patient that's scheduled for the operating room is now being seen in pre-op testing and has a nasal swab test for COVID. If they're in an outpatient environment, we're sending those to our commercial labs. And if they're going to have either an inpatient procedure or being seen in one of our inpatient facilities, they'll be tested internally. But every patient gets tested within 24, 48, or most 72 hours of surgery to make sure that they do or do not have the virus. So testing is a critical part of what we do. And testing is improving. As we've learned over the last couple of months, there are different ways of testing, and that's one of the reasons we brought many of them inside, and our laboratories are doing them. And there are new testing procedures that are coming on the horizon, which we hope to employ very, very soon.
And Sam, specifically, maybe if you could explain what a PUI is and what's being done for a patient either through the emergency room or on an inpatient status in terms of testing.
Right. So because of the issues with testing in general, patients that have a high suspicion of having coronavirus, despite waiting for a test result to come back over a 24, 48-hour period if it's being sent out, during that period, they're considered a PUI or a person under investigation for COVID-19. And again, once that test comes back positive or negative, then you can confirm the diagnosis of COVID or rule it out, meaning that the patient no longer has it. Testing is being performed currently at all our emergency departments. If the patient is not very sick and can go home and recover from COVID-19 at home, typically that's a send-out test, and it would take between 1 and 3 days for us to get the results back. But for most patients being admitted to the hospital, the results are available immediately through immediate in-house testing that we have. And those patients will be placed appropriately upon entry into the hospital, whether in a COVID unit or a non-COVID unit, with care being tailored to the patient's presentation.
Can you, to elaborate, can you speak a little bit about the PUI, about a person who comes in and we don't know if they have COVID yet, or if they do or not? What processes are in place in those patients? Again, they haven't been defined as COVID positive. They're not being put with other medical patients. So just again, elaborate on the separation of both COVID positive and patients who are suspected for COVID.
Right. So, if a physician is admitting a patient into the hospital and they have a high suspicion that that patient has COVID-19, that patient is under investigation for COVID-19, and they're considered a person under investigation. Whether that test comes back negative and the physician wants to repeat it and ensure that that's a negative test, or whether that patient's waiting for a test result to come back, we still take really strict isolation measures, including contact isolation and droplet isolation. So those are terms that we use in the medical community to describe the type of isolation that's there. And typically what it entails is a patient being in the room, obviously by themselves, and having all the staff members wear personal protective equipment that is fit for treatment of COVID-19 patients. Even if that's not a proven positive, it's a person under investigation, we still take the full safety measures necessary to treat a COVID patient until we make sure they are ruled out or they don't have COVID-19. Then we can pull back on those isolation measures. Now that obviously gives the patient a sense of safety and security, that they're being cared for in the proper setting, and it ensures that our staff that are taking care of that patient don't have a risk of contracting the virus themselves or passing it on to others. So those are critical that these isolation measures are carried out for all COVID patients and all patients under investigation.
Well, thank you for that certainty. There's a lot of anxiety regarding the testing issues, and both of you articulated very well both the measures being taken and the follow-up. Javier, Nancy, anything you want to add regarding testing?
No, I think for patients coming to our outpatient facilities like urgent care, we do have the capability to test if the physician feels it's appropriate. And as was mentioned, those tests are of course sent out to a lab. We usually get them back, the results, within 24 to 48 hours.
Thank you. Dr. Zinner, part of the reputation and innovation of the Miami Cancer Institute has to do with its participation in clinical trials. How are these being managed during the pandemic?
Great question. So we had prior to COVID a very active clinical trials program. When COVID hit, we suspended adding new clinical trials to our portfolio. But interestingly enough, even though we added no new trials, because patients were on trials, we actually had some of the highest enrollment over the last 2 months that we've had in the last 24 months. So we're just, again, much like surgery, slowly opening those trials again, opening up new trials and putting patients on. I mean, the reason patients get put on trials is when they often fail traditional therapy, we put them on trials to put them in, put perspectives in for new opportunities for treating their cancer. So we're underway again. We're beginning to open our trials up again.
Thank you. Thank you. This next question is also a sensitive question, which we get asked quite often by people in our practices and family and friends. When will visitors be allowed again? And Nancy, I'm gonna throw it at you regarding certain policies in place. When, of course, that's a speculative answer, but how it's being reviewed and what's being looked at. And if I could ask you, it's visitors to someone in the hospital, and then maybe if anyone can answer also in medical offices, what's being done for people to be able to come to the office with a FaceTime or some other vehicle for the family member.
Sure. We understand that it is a very sensitive topic. And so what we've been doing thus far, and again, I want to emphasize, we're doing it for the protection of our patients. At the end of the day, restricting that traffic into our facilities. But what we have instituted currently is ways for families to communicate with patients in the hospital via FaceTime. We do have iPad technologies, and we have regular rounding that occurs so that communication occurs with the caregivers as well as with the patient using technology. So we've been able to institute that as an interim measure. We are looking to be able to start phasing in visitors in the next several weeks. Again, we are planning that very carefully, if you will, because again, perhaps it will happen in a phased approach where we start bringing in visitors limited hours during the day. We continue to monitor, and then we continue to extend those hours within our facilities. So again, we are looking at it closely. We understand how sensitive that is and how important it is for patients to have their families with them. But again, we are trying to balance safety along with, of course, the emotional component of this very sensitive topic. With regards to procedures, once we resume visitors, we are probably looking at, if you're coming in for surgery, as an example, that you'll be able to bring one visitor with you. Again, we have to be very conscious of the traffic within our waiting rooms to ensure that, again, we don't have an excessive amount of people. So we will have to have measures in place to ensure that we have our staff being very vigilant of that within our waiting rooms as well.
Thank you. This next question is actually a little timely for me. The question is, what changes could be expected in the maternity area? How are we handling maternity patients? I will give a plug to listen to Baptist Health Talk podcast. And actually, a guest this week was one of our prominent OBGYNs to address exactly pregnancy and COVID. So look for the Baptist Health Talk podcast. But for the purposes of this Facebook Live session, I'm going to ask Dr. Fahmy, what changes are expected in the maternity area? What's been done to protect the mother and the infant?
Right. So specifically, any woman presenting for delivery of a child in our OB areas is going to be tested before the delivery, and we'll make sure that that person is not exposed and it's not exposing their baby to COVID-19. Further, we're limiting the number of visitors, of course. We know that childbirth is a very special time in everybody's life, so you can't have a no visitor policy, especially if the partner wants to be there and wants to be present. So we've allowed a little bit of flexibility from that end, but restrict all other visitors to that area just to ensure, again, the safety of our patients and the staff and the babies being born. And maternity is a unique location because there's the newborn babies are fragile, and it's one where we take seriously the safety precautions that we put into place. We obviously don't have any COVID patients in the maternity areas. We would move those patients out to a more specialized area to be cared for. So I think as it stands now, there are safety measures in place. You will be contacted for before delivery for instructions on what's going to happen during the stay. But needless to say, the environment here is safe, and everybody that's being cared for in that environment is being tested to ensure that we know their results before they deliver.
Thank you. Baptist Health Talk podcast. Javier, since much of the stay at home and the whole idea of flattening the curve was to allow for capacity in the hospitals and the ICUs to handle those that get sick from COVID or non-COVID, loaded question. How long do you think this will last? And I'm very sensitive to the context of the question. Let me phrase it a different way, make it easy for you. How long do you imagine these new safety measures will be in place?
Well, I think as we mentioned several times during this presentation, I think one of the things that we need to be very attentive is the evolution of this. This is all evolving for us. This is something new. We never really found something like this. I think we're exposed to a completely different element. And this COVID-19 is coming to stay with us. As I say, we don't have a vaccine. We don't even know if the vaccines that we'll have available will be working correctly or not, what level of protection it's going to give us. We hear every day and we read every day news regarding new medications. Medications are taken out from the armamentarium that we use to treat it. I think this is going to change a little bit of what we do. And I think in a way, evolving in the evolution about these new measures and the way we are implementing them is making a lot of sense. You think about it, keeping a little bit of a social distancing, keeping the appointments regularly, having pre-appointments, having people wait. It actually is something that might be even good for people. So some of these measures are going to stay. Some of these measures are going to evolve a little bit. Some of the relaxation might happen. And we have to be very careful with it because, again, relaxation is great because we're all looking forward to do things outside, to be with people. But we have to understand this enemy that we have, which is COVID-19, hasn't gone away. And it's definitely here with us. And we're talking about even second peaks or second waves. And I'm not sure exactly that's going to happen or not. But if it happens, we need to be as prepared as we're planning to be and so on. Please just simply follow that.
Thank you. And before I ask each of you for some last thoughts, one last question, and again, it's more granular than the articulate answer you just gave. Let's just let people know about masks, and I'm going to go down the list. Do each of you recommend that everyone wear masks when in a public space? And if not, why? And if so, again, why? And Nancy, I'll start with you.
I think, again, as we start going into normalcy, right, or new normal, as we call it, it is good as we start going into public spaces. And again, the normal things, a supermarket, running an errand, to make sure that we have our masks on. You enter spaces like an elevator, right? No matter how much space you try to put between two people, it's, just the physical space, there's a limitation. So wearing a mask is going to be part of our new normal for some period of time, in my opinion. So again, just carry it, have it with you. Because again, as we start getting into this next phase and more people are out, as we know that people want to start living, somewhat of a normal life, I think it's going to be part of our routine for some time.
Thanks. Mike, anything to add to that?
A mask?
Yeah.
Absolutely, positively, yes.
Thank you. Sam?
I view the mask and wearing a mask as an act of kindness and thoughtfulness towards other members of the community. You may not yourself need the mask, and you may be young and healthy and thinking if I have COVID, I'd be able to get over it. But you don't know who else you're taking it to, and especially older members in your family or friends or colleagues or even community members that you don't know that are older and have health conditions. To me, it's an act of kindness and being part of the community. And absolutely, there's benefits to wearing masks. But some of it has to be common sense. If I'm out in an open area that I don't have people within 10 feet of me, and it's consistently that way, you may choose not to. But if you're going to be in an area where there are people around you, within 6 feet of you in particular, then there's no reason not to wear a mask in those public areas. You have to protect others. You have to protect yourself. And there's very little harm to wearing a mask. So why not? Just do it.
Thank you. It is part of our social contract. We are all in private rooms, not wearing masks, but if we were to go out from this room, we would put them on. Javier, final comment on masks before we wrap up?
I think it's a little bit of a summary of everybody. I agree that we need to wear it. It's a commitment with the other people around you. We can go on regarding what the benefits or not benefits of the mask is and the new things that we'll learn. But I think at this moment, what we know at this point, I think it's absolutely necessary. And I agree with Dr. Sinner, in the public space in which you're going to have contact with other people, you need to wear a mask. Definitely, yes.
We can all show our masks that we have them readily available. Final comments. I appreciate all your time and effort. Nancy, anything to add to what's been discussed? Great question.
I just want the community to know that as a healthcare organization, Baptist Health has taken every measure possible. We convened a recovery task force, which really has taken a very comprehensive approach to recovery from every aspect: safety measures, infection control measures, how we're going to resume surgery, how are we going to bring our patients back to physician office practices to have imaging services. So again, we have looked at every single component of our business to ensure that safety is of the utmost. And it is really that guiding principle for everything that we're doing in this next phase. And of course, being very cautious, right? I think you have heard every speaker this morning talk about caution, being very careful, making sure that as we move from phase to phase in our recovery, that we are looking at data, and our approach has been very data driven. So I want our patients to know that, and our community to know that that has been really the most important thing for all the leaders here at Baptist Health.
Thank you. Javier, final thoughts?
Well, I think, again, it's just to reinforce the fact that we Baptist Health South Florida is working tremendously on the safety of our public, of our patients, and even our employees. That from the very beginning, we've been very, very adherent to the guidelines that we had. Again, as Nancy has mentioned, we are following any possible evolution of the science, any new recommendations, any new events that happen. We're updating every policy. So we're continuously working on guaranteeing the safety of everyone of our community. And I think it's important that people understand that we're not just simply a fact of responding to, we're actually preventive on the measures that we're implementing. We're trying to even go faster than what we're being recommended. So it's very important that they know that.
Thank you. Sam?
Yeah, I think obviously this has been a learning experience, and we've had to be flexible and adjust our protocols and the measures we put into place to protect people from the beginning until now. And I think we've landed in a place where we're continuing to evaluate the data and evaluate the progress of the virus and adjust accordingly. But in the meantime, back to what I stated in the very beginning, it is critical that people continue getting their medical care. We've seen a clear decline in the number of people who have serious conditions who have chosen not to come in and get them taken care of, and that puts them at higher risk. So if I leave with one message, I'd say, don't let COVID scare you away from coming and getting the medical care that you need, one that may help save you some serious complications down the road. Get it done now. The risk of COVID infection in the hospital is very, very low, and you need to get those issues taken care of if they arise.
Thank you. And Mike, Dr. Zinner?
I say to my friends and family and the community, now it's safer to come to our facilities than it is to go to Walmart or Publix.
Well said, and hopefully we communicated the reasons behind that statement to the people viewing. As one of the leading healthcare providers in the region, our patients and our employees have come to expect the highest standards of care from us at Baptist Health South Florida. Now more than ever, our patients are relying on our care. We're ready to care for them, especially those that may have delayed treatments during the pandemic. Through the steps, we're confident we can protect our patients and our employees, and as we safely care for the community. These safety measures have all been based on information from the CDC, the World Health Organization, the American Hospital Association, the Florida Governor's Office, the White House opening up America, various medical organization guidelines. For more information on Baptist Health Safety Plan, as visitor policies, please join us on the webpage of baptisthealth.net/coronavirus. That's baptisthealth.net/coronavirus. We give thanks to our panel of experts, as well as the thousands of healthcare workers at all levels of jobs in the Baptist health system, and the millions of healthcare workers who provided the same care nationwide. Stay safe.